with Monica, guys, and guess what? We are doing it, baby. Guess what? Real Talk with Monica is down here at Virginia Consumer Voices, guys. Right here at 1716 East Franklin, here in Richmond, Virginia. What did I tell you? Real Talk with Monica is bringing you the most important topics. And this time we decided to talk about healthcare. You know, Real Talk with Monica has suffered, as me as the hostess, Monica involved, have suffered a personal toll in dealing with the healthcare system because I was on Obamacare for a little while until eventually I got my benefits. But there's some people that's unfortunate cannot be between a situation where they cannot get benefits because they don't make the money. So, we wanted to get this important topic, and it's needed. This is one of the great organizations that's here in Richmond, Virginia. And you're going to meet 3 wonderful women that's doing great work here in Richmond, Virginia for healthcare, guys. What did I tell you? Healthcare does matter. So you're going to hear it from Karen Cameron to my right. Welcome to Real Talk, Karen.
Thank you, Monica.
So can you tell my Real Talk viewers a little bit about yourself and your position at VCB?
Well, I am the director of Virginia Consumer Voices for Healthcare, and that is the healthcare program of the Virginia Interfaith Center for Public Policy. And I've been involved in healthcare management and community development for over 25 years and have really dedicated my professional career to improving healthcare access for Virginians here.
That is great, Karen, and I'm glad you said that. But, as we going down, what does healthcare, hashtag healthcare matters mean? And why should my Real Talk with Monica viewers need to be concerned about healthcare?
Because access to good healthcare is fundamental to both the economic sustainability of families and our communities. Both in Richmond and across the nation. Basically, people don't have good health. They can't maintain a job. They can't earn the money for their families. They become disabled at young ages. That costs us all money. If people stay healthy and they get good early primary and preventative care services, which health insurance affords them, then they can stay healthy. They can achieve things in their lives, take care of their families. There's a big toll on our criminal justice system, on our financially, economically, and everything if people don't have health insurance. And people who do have health insurance end up having to pay when people go to the emergency room for care.
Right. And just like, just piggyback on it, just like on your YouTube channel, I was looking at one of the voices that you talked about when you was at the NAACP state. And you said, hey, this is not just a white, black, or anybody issue. It's poor people, it's everybody that this hurting, this suffrage, right?
Right, because anybody can lose their job, and then they don't have access, and even when they have a job, they may not have access to affordable health care. And having access to affordable health care is fundamental to our society.
That's great. But what are some of the myths about the healthcare system that it seems to be typically out there?
Well, I think one of the first things is that people assume that if you have a full-time job, you have access to affordable health insurance. And that isn't the case. Many people are working full-time jobs, and they, like I did when I came out of college, I had a full-time job. It was temporary. It offered no health benefits. And it was the major manufacturer I worked for. And I had a chronic illness, that type 1 diabetes from as a child, and I could not get the care that I needed. I had to pay out of pocket, and that put me at risk. And so that really has an impact. There's a lot of people who are in that gap. The other idea is that, well, you can just go to the emergency department if you get sick.
Right.
The problem with that is the only way you're going to be seen in the emergency department is if you have a life-threatening or critical illness, and then you're not going to get the follow-up care you need. You're not going to be able to see the specialist. You're not going to be able to get the therapy you need.
Right.
So in essence, what you're doing is forcing people to become disabled or to die at an early age, when those folks could well have been healthy, contributing people for many years if they had gotten adequate primary care.
Wow. And then I was looking on your website at that y'all have, and and I was wondering, what are some of the 3 reasons causing healthcare gap? here in Virginia?
Well, the first thing is that in Virginia, we are on one of only 19 states who haven't accepted the federal funding that's available. Right now, you can qualify for the federal marketplace and get tax subsidies, but you have to make at least 100% of the federal poverty level, which isn't very much. For a single adult, it's a little less than $12,000. So if you don't make that much money,
Why?
then you basically can't get a tax subsidy to buy health insurance. And most of the time, your employer's not going to offer health insurance, or it's going to be so expensive you're not going to be able to pay for it. So you're in the gap.
Right.
That's a big part of it. The other thing is that that a lot of people have part-time jobs, and they may have 2 or 3 part-time jobs, but they can't purchase it. See, Virginia could take the federal funds. It's completely 100% federally funded, and then we'll only drop down to 90% federally funded through 2020, and we could be taking advantage of that to actually get folks health insurance that are what we call the working poor here. I mean, and of that group, there's like 20,000 veterans or their family members. So these are people who have served our country. There's a lot of people who have worked for years. They get unemployed. They all of a sudden can't afford health insurance. And what we're doing is basically denying these people the ability to stay healthy.
Wow, that's true. And I think we was talking about Speaker Howe. If you seeing this, we need to get some things going and stop blocking legislation. This is real talk. That's what we do, baby. We call you out. So we want to send this message directly to you, and you will be seeing this DVD video coming to your attention. Strictly Real Talk with Monica style. Now that's real talk. Okay, so another thing I want to go, what drives you to do your job? And do you have a personal story into why healthcare affected you personally?
Well, yeah, and I alluded to that earlier.
Yeah.
I had type 1 diabetes at the age of 13. I went to college. When I got out of college, I went to University of Virginia. I went to one of the best schools in the state. But when I got out, I got a full-time job, but it didn't offer health insurance. And the health insurance that would have been available to me would have cost 1/3 of my take-home salary and wouldn't have covered my diabetes.
Wow.
So what it ended up doing was I actually then went to graduate school, and there part of the time I was in graduate school I didn't have health insurance. So I went about 3 years off and on without health insurance. Fortunately, I stayed extremely healthy, but not everybody's that fortunate, and we shouldn't be forcing people to not be able to take care of themselves. I met a young lady not long ago who had she had graduated from college. She had gotten diabetes in college, and this was right before the Affordable Care Act went into place, and she was just praying to stay healthy enough till it went into place, because she was working 2 part-time jobs, and she was already having some kidney failure as a result of not being able to get the care that she needs. So we can't have tragedies like this.
No, we can't.
And it's not right when the money's available that our legislators here in Virginia are denying people this care.
That goes to one of our questions. What are some of the current projects that VCV is advocating to the State General Assembly?
So what we're doing is we're trying to get grassroots folks, where we're going to work primarily with our faith communities, but we're also working with community organizations. And what we need is folks to live their faith. The Abrahamic faiths all talk about caring for the least of these and caring for folks, our neighbors, and we've done some interfaith events that have highlighted that. And so we need to be, we're going to be organizing these folks to do letter writing campaigns to General Assembly members, to be meeting with them, to be talking about the economic impact of us not taking that funding. We are continuing to lose ground with other states and our population. Louisiana just adopted Medicaid expansion. For years, they were lower than us on health status indicators. We were 48th in the country on our Medicaid eligibility. Well, pretty soon we're going to be at the bottom of the heap. And does Virginia really want to be at the bottom of the heap?
I don't think so. So this is a message coming right to you, guys. You know, November election is very important to vote out people that does not have the right backing and the right, like Karen was saying, the right faith in doing their job to help all mankind. And so the final question is, what are the present and future goals for VCV? What you think, Karen?
Well, our goal is to get Medicaid, is to get coverage for all. We're also doing work on The insurance mergers, you all probably have heard about the 5 largest insurance companies becoming 3.
Right.
And we've been actively trying to keep consumers having the opportunity to comment on those things. And we're monitoring network adequacy, we call it, in the plan. So once you get insurance, the thing is you got to make sure you have a provider who can provide that insurance. So we're trying to make sure that consumers have a voice in that as well. So we have a lot of things on our plate trying to make sure, and then making sure that people, once they get insurance, they know how to use insurance.
Right.
And so we can do education on that, and also making sure that people have a resource to go to when they have difficulties, and we can try to get them to the right person to help them. We're a resource for the community.
Okay, Karen, and tell our viewers where they can contact you at if they need any direct information.
Well, our website is vaconsumervoices.org, and you can go on our website and you can get our contact information there, and you can see stories about people who are falling in the gap,
Right.
and you can see resources, materials. We also have a weekly newsletter we send out every Friday, and you can join. It says join us, and you can join up on our weekly newsletter and get our newsletter every week, and we'll keep you up on the latest. And during the legislative session, we'll be sending out action alerts and asking you to contact your legislator.
And we might not have her on camera, but Casey, she's the lady, guys. She be whipping them all up. Casey, Mighty Media, guys. If you didn't know, she sent out.
That's actually Mighty Casey.
Mighty Casey. We got to tell her. Mighty Casey. I'm sorry. She's actually whipping those letters out, guys, to keep you informed and to get you informed about healthcare that matters. So, Karen, introduce you to this beautiful lady right here to my left.
Well, to your left is Cassandra Shaw. Cassandra is our outreach coordinator for our healthcare program. She is a minister, a reverend here, and she just knows, she really knows the community, and she knows folks, and she's out there helping us to spread the word. And so I'm going to introduce Cassandra to you.
Well, guys, let me introduce you, Cassandra, guys. I'm a little biased here. I already know this lady on camera, so it's a pleasure for now to have her a part of Real Talk with Monica. And it's just a pleasure, guys, because I seen Cassandra. She was always a street fighter in my days when I worked with the Postal Service. She was always an advocate into getting things done, and it didn't surprise me that she's working with this great organization, and she also works with the NAACP. Like Karen said, she's a minister. This woman she's like James Brown, the hardest working woman out there. So guys, let me introduce you to Cassandra Shaw. Welcome to Real Talk.
Well, thank you, Monica. It's a pleasure to be here.
Yes. Thank you, Cassandra. Can you tell my Real Talk viewers a little bit about yourself and your position here at VCV?
Well, basically, you've covered the main things.
Okay.
I am a minister. But while working here at VCV, Virginia Consumer Voices for Healthcare, my task is to, or my actual job is to be the outreach coordinator.
Okay.
And a part of that is what it says, outreach. As you already said, I am in the community. But here at VCV, my task is to reach the faith-based organizations as well as the community, and that includes organizations, NAACP, unions, and so forth. But that includes going out, doing presentations, doing talks, and Karen covered a lot of it. But the main goal is to do advocacy, and that's one of our main goals in January, is to reach the people and have people to go up to the General Assembly. That is a part of our advocacy.
Okay.
We have partnered with coalitions that they are covering the whole state.
Wow.
And we have different chapters throughout the state that are working along with us. But mainly my goal is to be the voice of the voiceless.
Right.
That's a part of what I do.
This is great, Cassandra. Do VCV partner with any other healthcare organizations?
Yes, we do. Yes,
Okay.
we do. We have, like I said before, we have coalitions.
Okay.
We have statewide.
Oh, wow. Okay, and does this job put like emotional toll? And when I say emotional toll, it's like hearing some of these stories that we're going to interview later, like Rolanda McMillan and Christopher Green.
Very good question. Very good question. Yes, and Rolanda and Christopher, I've known both of them for quite some time. I worked with another organization for about 2 years, and they were a part of that organization.
And what was that organization?
That was Raised Up for 15.
Okay.
Fighting for the fast food workers to get their minimum wage raised to $15. And they're still out there. They're still on the ground fighting. But Rolanda and Christopher are true leaders.
Okay.
And in particular, Rolanda shared a story on our Facebook page and on our YouTube about her not having health care coverage.
Right.
And
she
having to
worked at what,
choose.
McDonald's,
Yes,
right?
she does. And she does not have health care coverage.
Right.
She also has to choose between paying her rent or buying medication.
Okay.
That's a lot of our stories.
And then Christopher was what, a convicted?
He's a convicted felon.
felon, yeah.
He's just got his rights restored.
Yeah, that's
Yay!
great. Governor McCullough signed that into law.
Thank you,
this
Governor.
year. That's
But Christopher had an interesting story because at one point Christopher was homeless.
great. Oh, wow. Yes, he did.
He was homeless. And no insurance, no job, no income coming in. And so a lot of times Christopher, if he got sick, he couldn't go to the hospital.
Right.
He couldn't attend any type of medical institution. But today we can say, because of VCV, Christopher has partnered with or has gone down to VCC and has gotten some type of medical coverage. So that's a plus for him.
Okay, so what was a typical person? How do y'all help, how your organization help people like Christopher? Can you briefly walk, what would they need to do? Just go on your website? And
Well, actually, he would come in. He has
Okay,
come
come
into
in,
the
okay.
office, and he would talk with my director, Karen.
Okay.
Or either he would talk with me, or he would talk with Demetria.
Okay.
And we all can give him some type of direction.
Okay.
As to other health organizations.
Okay, so that's great. So what drives you, Cassandra, to be VCV outreach coordinator and still be involved in other community organizations like the NAACP?
Well, this is one of my favorite sayings: community and labor work together. You will hear me say that all the time. I believe that.
Right.
And I love to talk and work with people. The person that's down in the trenches, that's me. I'm going to get down there with you.
You think
And-
that maybe be your true calling that God gave to you?
Well, you know, my favorite verse,
Yeah.
my favorite verse is in 1 Peter. And it basically says, God has given us all gifts,
Right.
but we are to see the gifts in others and to be able to allow them to use them.
Amen.
I try to live by that.
That's great.
That's great.
What regions do your organization covers in Virginia for assistance?
We cover the entire state.
Okay.
We cover the entire state.
Great, Cassandra. Can you introduce you to this beautiful lady,
I
to the
would-
family, to the end?
Well, honored to. This is Miss Demetria Garden. She is our super duper volunteer coordinator.
Okay. Welcome, Demetria. Welcome to Real
Hi,
Talk.
Monica.
Hi,
I'm so
nice-
glad to be here.
Yes, glad you have on the color and you're rocking Real Talk colors, so
All
you know I'm
right.
already a fan. That's Real Talk.
All right.
Well, thank you, Demetria, for coming on. Can you tell my Real Talk viewers about yourself and your position at VCV?
Sure. Well, I'm the volunteer coordinator, and as Karen mentioned earlier, we are advocating for persons who do not have accessible health care coverage or affordable health care coverage. So as we are going out advocating with legislators, Cassandra is going out doing outreach to different faith-based organizations
Right.
and throughout the state, different communities. I'm going out to get volunteers. We are creating a movement. We are getting people involved who has been impacted by not having affordable health care coverage. So my role is to go out, motivate people, get them together, give them the tools and resources they need, because I understand. I relocated from New Jersey about 2.5 years ago, and I've always had part-time contractual jobs.
Right.
Never a full-time job. Which means what? No full-time coverage,
Yeah.
health insurance.
Right.
So I had to use the Affordable Care Act, thank you President Obama, the Obamacare, and it's helped me. But there's so many others who cannot afford it. As Karen
Right.
mentioned, they can't afford the subsidies, which are tax credits, which are discounted rates. So we're here to galvanize and to really pull people together, volunteers throughout the state, and we need people.
So what do you think, and just to think, if there's no Obamacare, what would you think would happen?
Well, I'm glad that's a good question, because before I started working here, I was an in-person assistant. I was an enroller. So
Okay.
I enrolled persons into the Affordable Care Act, Obamacare.
Okay.
And so many stories. People were coming and who could not afford it.
Right.
So for instance, there's one story of a woman who said to me, you know, Demetria, I really need the health insurance, but I also need mental health services and dental health. She's
Right.
like, look, I can't even go in for an interview because I'm missing my front teeth. So
Wow.
she's like, well, how can I get on my feet when I can't even make it through the door for an interview? Then there was another guy that I met, and over the last 6 months, he was losing his voice. He has different polyps on his vocal cords. And so he says, well, me as well. How can I get a job interview? How can I make a living where if I go in and give it my best, I can barely even speak?
Wow.
So he needs medical insurance. So it's medical insurance, dental insurance, mental health needs. If people are not getting it, as Karen mentioned, you're stifling the economy.
Wow, that's great to know that you're a fighter and you know the struggle. So it just is
Yeah.
a personal fight. That's why you do what you do here, obviously. Another question is, and you need to know about mental health. You had called in on a segment that I did on Real Talk with Monica
Yes.
Live, and I'm glad you called in. I had Louise M. Davis and Dr. Cat Ford, and so we wanted to know, why is GAP, Governor's Access Plan, important value to know for my viewers, again, in case they didn't see that episode?
Sure, yes. So the GAP plan, which is the Governor's Access Plan, is a healthy initiative under our current governor, and it's a great initiative for persons who have severe psychiatric mental health illness. So for those persons, there is the plan, the Governor Access Plan, GAP plan, I can give you information on it, where they can receive medical treatment for their illness. It's also for behavioral health issues, including substance abuse disorders.
Okay.
So persons who make up to, as of July 1, 85% of the federal poverty level. So with anything, Obamacare, any type of medical enrollment, there is a financial guideline. So a single person will have to make at least around $10,000. Once you call in to apply, they can tell you more about it. But what it would give them is services for their mental health issues,
Right.
outpatient services, psychiatric medications, counseling services, peer recovery, which is really good because
Right.
if someone's in a crisis in the middle of the night, there's a 24-hour hotline number.
Okay, and what
So
can
that's
they
a good
find the
resource.
information at?
I'm glad you asked.
Okay.
So they can go on to, pull out my handy note,
Okay.
www.coverva.org. www.coverva.org. And there's a number, 1-855-869-8190. Mental health is so important. I mean, we're reading about the stories day in and day night on the news. So
Right.
not only is your physical health important, your dental, your mouth,
Right.
your dental needs, but your mental health. Healthy mind, healthy body is all connected.
Okay, great. So why do you choose to volunteer your service at VCB?
I volunteer because I understand. I've heard so many heartfelt stories, and it's really sad. The stories of people who are just hardworking, good people, parents, part-time workers, spouses of veterans, just people who don't have access to a full-time job with coverage, but yet who does not have that health care. So I'm really, heartfelt and really on the toe on the line with these wonderful ladies here about going out, spreading the word of what we do, asking people to join us as volunteers, to be a part of the movement, to help another. One hand washes the other.
Right, that's great. So do you need more volunteers to sign up here at VCB?
Yeah.
All hands now, all hands on, guys. Okay. So what kind of information where they can find you on the website?
Yes, on the website, you can go to the general website, which is vaconsumersvoices.org, and you can sign up, as Karen gave the information earlier. We are looking for volunteers throughout the state. If you can speak, if you can write, if you like to present, if you just like to hold a banner and smile, we want you.
All right, guys, and thank you. So as we go around the room, round robin, and start back with you, Demetria, what is your final word for my Real Talk viewers?
The final word is
One day, this could be you or a family member who's in need of help and service. And it's always good to pay it forward. So we're looking for people to help, to assist, and we would be greatly appreciative of your time.
Okay, Cassandra.
I'll keep mine very brief. Healthcare matters.
Right.
Hashtag healthcare matters.
And you, Karen?
And my philosophy is always that persistence pays off, that we will win this fight. We just got to have all hands on deck. And people keep saying it's not necessarily if it happens, it's when it happens. But the issue is we can't afford to let that go on too long, because people are dying, people are getting really ill, and all of that is something that our legislators and our public policy folks could take care of, and they just need to do the right thing.
And also, you need to get funding. And
Yes.
That's right.
Exactly, and our resources, our staffing resources, of course, we're grant dependent, and the grants are always, in many of the other states, the grant that we've been primarily funded under is a national grant. Well, because so many of the other states have expanded, that national grantor now is moving on to other things, but we're in that group that still needs to work on this issue. So we're always looking for personal contributions,
Right.
corporate contributions, foundation grants, to help to fund our efforts to educate the population.
And they can donate right on your website, is that correct?
Exactly.
Okay, and tell you where you can find your website again?
Yes. It's at www.vaconsumervoices.org.
Thank you, and thank you, Karen,
Thank
and thank
you,
you,
Monica.
Cassandra, and thank you,
Thank you.
Demetria. And guys, as a final word, Real Talk with Monica is a big supporter of organizations like Karen, that's a forthright of like Virginia Consumer Voices that needs to have their voices heard in this important matter, because guess what? Behind the voices of healthcare matters, it does matter here in the state of Virginia. So I'd like to thank these Virginia Consumer Voices for giving me the outlet to interview these three great ladies. But before I close out, I want to thank our sponsors, Pinup-ish of Richmond, RVA, that's Jamie Jones is the owner, also Edified Barber Academy, and then also Your Barbers at Mario. Real Talk with Monica need more sponsors to present great quality work that we do and more people on board. So guys, please visit our website, realtalkwithmonica.com. And guess what, guys? I think that's hashtag healthcare matters, hashtag real talk, hashtag that's real talk, hashtag and everything else, guys. Support these great organizations, Virginia Consumer Voices. Now that's real talk.